All right. Good evening, everyone, and welcome to our Health, Aging, and Disabilities Committee meeting. We have three agenda items for this evening that we'll be discussing. I'm going to first start with introductions. I am Councilwoman Rashima Dixon at large member, and if other council members can introduce themselves.
Linda Gray, First District.
Michelle Harley, 4th District.
Yolanda McCoy, 6th District.
Great.
Trippy Congo, Council President.
Great. And I see that Councilwoman Fields is on as well. If folks can put themselves on mute. Perfect, thank you. So we'll jump in and get started. So this evening we will start with a presentation by the Swank Center for Memory Care and Geriatric Consultation at Christiana Care. Who this evening will be speaking from Christiana Care?
Like did they have no meetings?
Yes, hello. This is Dr. Jim Ellison. I'm a geriatric psychiatrist from the Swank Center, and I'll be joined by Jennifer Ritterizer for this presentation.
Great. And I also, just before you start, just wanted to recognize that Councilwoman Oliver had joined us as well.
Thank you.
Would you like me to start?
Yes, you can get started.
Well, good afternoon or evening, all of you. Thank you so much for inviting us to talk with you about a program that we're very excited about that combines community education, telehealth, and concern about populations in the Wilmington and Delaware vicinity that may have healthcare disparities in terms of access to health education and health care. We're going to talk for about 15 minutes about this program called the Memory Care Ambassadors. But first, let me tell you a little about the Swank Center and what we do there. Can I see the next slide, please? You're at the very end, not the beginning, I think, of my slides. Are you? No, okay. Then thank you. Please go back to that then. All right. So it's been 113 years since Dr. Alzheimer described the dementia that now bears his name. And it's become a hidden pandemic along with much more pressing and urgent pandemics like COVID. In Delaware alone, there are 19,000 people who suffer from Alzheimer's disease, and the number continues to increase. Can I see the next slide here? Next slide, please. Yes. The number continues to increase because as the population grows and gets older, we've done very well treating some of the serious diseases of old age, like cancer, heart disease, and stroke. And the biggest risk factor for developing dementia is age. So as people live longer with these other diseases, they're more vulnerable to developing dementia. Now, the good news about dementia is that it takes 30 or 40 years to develop in a vulnerable person. And it's influenced more by lifestyle than by anything else. The World Health Organization says maybe 40% of people with dementia could have their disease delayed or prevented by better attention to lifestyle. And I realize the printing on this slide is small to read. So if you look at the column of words on the right side, you'll see that some of the prominent issues that are risk factors for dementia development are lower educational level, hearing loss, traumatic brain injury, high blood pressure, excessive alcohol use, obesity or sedentary lifestyle, smoking, depression, isolation, inactivity, air pollution, diabetes, and together these account for some 40% of modifiable risk. Can you show me the next slide, please? We address this through the Swank Center, which is Delaware's first and most comprehensive program for people with memory disorders, by reaching out into the community with trained volunteers, and Jennifer will tell you more about that. And we talk to the public about the lifestyle interventions that might reduce the risk of developing dementia in older age. I put together this mnemonic called Dancers to remind us all of the ways that we can live our lives in a way that will promote healthy cognitive aging. And of course, what's good for the brain is also good for the heart and other internal organs as well. Dancers stands as follows for these words. D for disease management, for example, high blood pressure, diabetes, obesity. A for stay active, have active physical experience during the day, not just exercise, but a generally active lifestyle. N is for nutrition, and we teach about the MIND diet or the Mediterranean diet, which are low in calories, saturated fat, dairies, and sugar. C is for cognitive stimulation, keeping active intellectually with pursuits that stimulate the mind, but also involving other people, which is the E for engage in social activity. Many kinds of cognitive stimulation are also social, such as playing Scrabble or doing a jigsaw puzzle with somebody you like. R is for relax and meditate to reduce stress. And S is because sleep plays a very important role, not only in preparing us psychologically for the next day, but also physiologically, our brain renews itself while we are asleep through the actions of the cerebrospinal fluid flowing through and cleaning the brain. Next slide, please. The Swank Center, as I mentioned, is Delaware's first and largest program for assessment, diagnosis, and management of people with dementia or milder forms of cognitive difficulty. All of these fall under neurocognitive disorders, and we talk about mild cognitive impairment and major neurocognitive disorder, which is dementia. Our team is holistic, interdisciplinary, and multifaceted, and our mission is to improve the care of older adults in Delaware and beyond as we spread, improving detection and care of cognitive disorders. Next slide, please. Swank Center has three major dimensions. We provide clinical evaluation, consultation, and management to the medical community. We also educate the medical community and provide mentoring and bedside teaching, and we teach the public. And we have research trials going on as well, which are voluntary opportunities for appropriate people to try new medicines that might help cognitive impairment. Next slide, please. Now you're going to hear from Jennifer Ritterizer, who's director of the Swank Memory Ambassadors Program, which is a memory wellness educational program. Jennifer, I'll turn this over to you, okay?
Okay. Hi, thank you, Dr. Ellison. I'd just like to begin by thanking Councilwoman Dixon and the Health, Aging and Disability members, committee members for having us here today to give us this opportunity to speak with all of you, provide some education, and then hopefully work together to improve a memory healthy lifestyle for each of us so that we continue to age as well as possible. So I always start by asking people, just think to yourself, when was the last, did I have a physical this year? Did I see my dentist this year to have my teeth checked? Did I have my eyes checked and go for an eye exam? Did I have my memory checked? And when I would see people in person and we would have this discussion back and forth, the hands would be up. They would be up to the dentist question. They would be up to the physical question. They would be up to having their eyes checked question. And then when I asked about having the memory checked, so many hands fell. There were such a few percentage of people that actually reflected and knew that they had had their memory checked, and so many that had not had it. So next slide, please. So first, I'm just going to start with some slides. I'm not going to read each one by one, but to educate all of us that memory disorders are a public health crisis. There are so many things going on right now, but this is something that does need attention as well and education in the community. So just to provide some information, population in Delaware, 65 years and older, 185,000. Number of Delawareans with Alzheimer's disease, 19,000. I'd like to just jump to, again, Alzheimer's emergency room visits in 2015, 28,522. How difficult is it to take care of someone with dementia in the home? Sometimes the family just doesn't know what to do, and they take them to the emergency room because they need help. We could just talk about the number of deaths is 660. Maybe you just scroll down a little further, please, on the slide. Okay, and then also just to mention, okay, we have these people in the community that are struggling with these diseases as well as their family members. What resources do we have? So let's take a look. Memory disorder clinics in Delaware, there's 2. Geriatric psychiatrists in Delaware, 3. And inpatient geriatric psychiatry units in Delaware, there's 4. So there's really an opportunity for resources, but we want to catch things earlier so that we don't have to use inpatient services and things along those lines. We want to catch this early on and do what we can to keep our brains as healthy as possible. Next slide, please. Okay, so now I'm just going to share some do you knows. So the average caregiver is a woman in her 40s, married, employed, caring for her 60-year-old mother who does not live with her. So think about that sandwich generation and all of us who are trying to balance so much. And then you have that parent who's calling multiple times a day because they are forgetful of something. Do I have my doctor's appointment today? Why aren't you picking up from my doctor's appointment? So it's stressful for that family member as well. The risk is 1.5 times higher for individuals who identify as Hispanic or Latino, or 2 to 3 times higher for those who identify as Black or African American than non-Hispanic white individuals. Nearly 2/3 of Americans with Alzheimer's disease are women. And in her 60s, women's estimated lifetime of developing Alzheimer's is 1 in 6. So these I am reading to you because they're just so impactful to me every time I see them. So if we look at the risk of developing breast cancer, it's 1 in 11. Alzheimer's is 1 in 6. But how many of us are so compliant with going to the gynecologist every year to have that mammogram, get that script, have that mammogram done, and have checks and be proactive for breast cancer? But really, what's impacting more of the women in this right now is dementia and cognitive disorders. Next screen, please. So here's just some information to talk about cognitive impairment, and are we recognizing it? And are we recognizing it earlier with the providers that we have in the community? So just to read Alzheimer's Association surveys regarding cognitive assessments. Cognitive assessment is supposed to be done as part of the person's annual physical. Oftentimes, the primary care provider has to get through so much information in such a short period of time to do that annual assessment, memory assessment, that only 16% of the seniors get a regular cognitive assessment. So in many cases, people will walk out without having had that cognitive assessment and their doctor not picking up on that they may be struggling. So who else is available? What are the resources there to help? Because this is so important. Well, that's the Swank Memory Ambassadors team. Next slide, please. So who are the memory ambassadors? We consist of screeners who are qualified and trained. We used to meet with individuals in person, but now during the COVID epidemic or pandemic, we're currently meeting with people via Zoom. What do? We facilitate free, confidential memory screenings in the community. We provide educational materials and community resources on memory loss, dementia, caregiving, healthy aging. So some of those things is we have a dietitian that comes with us, and she'll talk about a brain healthy diet and go through what are good choices to make in your diet and what are some that you may want to avoid. So it's really helpful just to, I think, open people's eyes. What can I do now to help my brain stay as healthy as possible? Because we all want to be proactive. What we also do is based on the results of the memory screening, which I'll show you an example of. We will give the person results, and with their permission, I think this is like the most unique portion of our program, is with their permission, we'll send those results to their primary care provider. We want to work hand in hand with that individual and the primary care provider to say, these are the results of the screening. We suggest that you, maybe depending on the results, we suggest that you meet with the primary care provider, or you just go to your next annual physical because things look okay. And I'll show you what that documentation looks like a little further on. Next slide, please. Okay, so here's an example of our virtual room for our confidential memory screenings. So we're in this large Zoom right now, and if I were having a memory screening done, I could be distracted by different people's faces, by sounds, and it's also confidential information that I may not want other people to know. So how do we use Zoom to the best of our ability to make a confidential screening happen? And here's a picture of what it would look like. So there are individual breakout rooms. Right now, we're in a room together. Based on the number of screeners, which is usually about 6 to 8 people, we'll have 6 to 8 breakout rooms. And the person on the top, who's our community member, is coming into this electronic virtual on their iPad breakout room with me. I'm the screener. And then there's the screening on the right. So they get to see the tool too, which is asking them the questions, because somebody may not hear as well as they can see. So it's the option that they can hear me asking the questions and that they could read the questions if they'd like, and or even benefit from both. So this is actually what the person would see on the screen. They have their privacy or going through the information. Next screen, please. Okay, so based on those results, we never provide a diagnosis. Based on those results, we'll provide feedback to the primary care provider. We never want someone walking away thinking, oh my gosh, I have dementia. Oh my gosh, I have Alzheimer's disease. It's not the case, and that's not what we're trying to do. We want to highlight for that individual and for their primary care physician that Jennifer's scores they were off. She did not score within the normal range of 2 of the cognitive assessments that we do. One is the AD8, which is the person's self-belief of how their memory is. And the other one is the Mini Cog score. And that's another assessment. And that one is more clinical in nature. We send these scores to the medical provider with the permission of the person that we screened. They may say, no, I just want to hold on to it myself. Or they may say, yes, please send it to Dr. Smith. And we send this to the, and it could be the primary care provider. So we send this to the primary care provider and let them know. And then they can take that information, or the individual who participated can reach out to their primary care provider and say, hey, I'd like to review these results with you, because it may be something related to a medication, and that's why their memory is being impacted. It could be a side effect. They could have just had a bad night and didn't sleep well, or maybe they didn't eat their breakfast and they're not on top of their game. It could be some other condition that could be affecting their memory, or maybe it is early signs of a cognitive impairment that needs further evaluation. And the primary care physician may choose to try to do some treatment for that, or make a referral to a place such as the Swank Memory Ambassador Program. So next slide, please. Okay, so just wanted to share some statistics with you of the screenings that we've done. The program has existed for 3 years now. And I just wanted to bring the most recent data with me today to share with you. So we do cover the entire state of Delaware. We will, in the past, we would go physically to the locations, and we would bring our own AV equipment. We would bring our own screen. We would bring our own speakers and microphones, because we know many of these community centers don't have all of that equipment available. So we brought it with us so that we can provide the best education possible. So if you look, 22 locations, we screened in 2019, 353 people. You'll see there's more women than men that we screened. The average age, 74. And if we look at the people that were positive on the AD8 assessment, which is the individual assessment, how do I think I'm doing, 30%. And on the Mini Cog, it was 32%. that scored positively. And when I say positively, it's in a negative nature, actually. It's not that they passed it, it's that they did not score within the normal limits. And then there were 9% of people who scored below normal limits in both of the assessments. And then a positive on at least one measure were 52%. Next slide, please. Okay, and here are statistics for 2020. So you see a drop in the number of people that we've screened, 88. So it took us a little while to figure out, okay, how do we do this virtually? So part of the reason for the fewer numbers. So locations screened were 5, subjects 88. Again, you kind of look at the male and female demographic percentage, about the same. Mean age, about the same. The positive 88 score, 35%. So you can read this right, down below. Positive on both, 18%. And this is one that we added to start taking a look at, but who's getting treatment for cognitive impairment? So we're identifying all these people that are showing some symptoms of them based on either of the assessments or both the assessments. Who's getting treatment? And if you look, only 5% of the people that we've screened are actually getting some type of treatment. Next slide, please. So here is how do you get a memory screening? We're reaching out to individuals and hoping and speaking with you today that we can identify groups. We've had senior centers reach out to us. We just did one with a local one in Wilmington that had over 100 participants online for the education. And then we broke out in the next few days to be able to do the screenings with everyone who wanted one. So if we can click this link here, please, and I can kind of go. Okay, so here is our Swank Memory Ambassadors program. So reaching out here, if we could just go up further, please, on the slide, on the website. Thank you. I'm just going to move myself over here. See you all a little better. Okay, so if you take a look at this slide here on the top, we were really, when we were putting this website together, really wanted to make sure that we reached out to everyone. So you can see it's a diverse community that we have that we're showing in this picture. It's not just one person, it's male, it's female, it's different ethnicities. We really wanted to reflect that so that when anyone came on the website, it's kind of like, oh, that could be me. So that, and then also on the left there, as I had talked about, we remind them, you've made all these appointments for other wellness checks, have you had your memory checked? Then we have some questions here down below, and it's just asking the person, how do you think your memory is? And do you think you'd benefit from a screening? And then you could just see kind of what I already told you underneath about who we are. And then I'll look down a little bit further, some more statistics of some that I've shared with you. Down a little bit further is how we're committed to you in the community, is that we want to enhance and provide you education on the brain healthy lifestyle with, as I mentioned, a dietitian. And we also have a nurse navigator who comes and talks about falls prevention. To learn more about Alzheimer's disease and related disorders, because sometimes people just want to understand that better too. And then to find resources for the memory care. And then here we have, if you click the button for the signs and symptoms of memory disorders, you can see that they drop down here. So we didn't want to make the website overwhelming, but if people want to look and see, oh, am I having changes, or a spouse of someone or a child of someone may say, I'm noticing when I go to mom's house, she's, telling me that she saw the same that she saw a movie today, and that she keeps seeing it every day and tells me about it as if it were a new movie. So taking a look at these, it's a great resource for caregivers as well. And if we look at the slides, or if we look at the slide over to the right, or the website, I should say, if you go up here, it talks about who our team is. And if we go above who our team is, right here is the registration for an online assessment for the online program. So the person would just need to come in, enter their first name, last name, email address, if they would like results sent to them, other zip code. And then if they click on event date, it'll tell them when we have the upcoming events. So the upcoming, we're calling them memory wellness fairs, because we're really talking about different services that can help promote one's wellness and memory. So they could choose a date. And also we ask if they have a primary care physician, because we also have a health guide that will help people who don't have a doctor, help them find them and connect them with the right resource there as well. So that's really how they would sign up. Now, to share with you, sometimes this is scary for someone. Oh, I'm going on a website and I have to register and give my information. If they're within a group, a church, a senior center, things like that, I've had groups give me just a list of this information on a spreadsheet or something, and I'll enter it for those individuals so that they don't get overwhelmed or afraid to do it because they're afraid of, can I do this and enter this in the computer? So we can work with your population on, or the organization on, how to do this best and make it easiest for the location and for the people who are going to participate. Next slide. Okay, I think we had one more slide for questions. But one of the goals, for being here today and why we appreciate it so much is because we know you have so many connections in the community. And we've reached out to so many people, but we think there's so many more groups, organizations, just a bunch of people out there that we want to really help more. We want to see what more can we do for our community? How many more people can we help assess and really be there? So we hope that you can be our partners in reaching out to individuals in the community to educate them about our program. And then my contact information is on the slides as well, that you can reach out to me, or whoever the facilitator for that organization is can reach out to me as well, and we can make things happen. So thank you for your time today. And I'm not sure if we have time left, but for any questions for Dr. Ellison or myself.
Yes, we have a couple of council members that have their hands raised. So I'm going to, and thank you so much for the presentation. Again, this was, I think, very informative for I know for me. I didn't even know this existed prior to working with through email introduction to you all. So this was great. Thank you. I'm going to say first up is Councilwoman Gray, and then I'll see you, Councilwoman Oliver, afterwards.
Thank you very much for the presentation. This is very close to me since my father died of complications of Alzheimer's. But I have several questions. One is about the test. Is it a memory test? And what type of recommendations are there for treatment? And my last question is, where are we in, where is science in determining how the hereditary factors into acquiring Alzheimer's? I know it's changed, or I've been told it's changed.
Jennifer, I'll address this, okay? So
Sure.
The first thing is, what tests do we use? We use two tests. One of them is more of a self-report. It's called the AD8, and it's a list of questions about how a person feels they're doing. The second, which is a little more objective, is called the Mini Cog, and that's a performance test. It asks the person to remember 3 words and to draw a clock. And we score them both on the memory of the 3 words and the drawing of the clock. Between the performance test and the self-report, we can get a reasonably good idea. It's probably only 70% or 80% sensitive. There are certainly people that have cognitive impairment that we'd miss, but a lot of people who would otherwise not be tested get detected in this way. There are also some false positives, like Jennifer said, person who might be having a bad day. Now, the second question you asked was what kind of guidance or treatments are available? And the Memory Ambassadors is not a treatment organization, but we refer back to the primary care or to the Swank Center if somebody needs a specialist, where treatments are available. Now, the treatments for early stages of cognitive impairment are primarily based around lifestyle and health interventions. If a person has untreated diabetes or they have sleep apnea that isn't managed appropriately, we make sure that they get evaluated and we encourage them to get treated. We also can encourage people in later stages of cognitive impairment to take some of the medicines that are symptom reducers, but they're not curative medicines. Now, the good news is there are a number of medicines under consideration by the FDA currently, which may be disease modifying. And we're hoping over the next few years that we might see some medicines that not only help symptoms, but favorably shape the course of the disease and make it either slower in its progression or stop it from progressing. So far, nobody thinks that there's a way to reverse what's already been damaged. The final question you asked was about heredity. And the answer to that is that most cases of Alzheimer's disease are not inherited. They're mostly what are called sporadic. There's a small number of people who have familial autosomal dominant genetic mutations. That's probably way less than 5% of people with Alzheimer's who have had an onset less than 60 years of age when they first develop dementia. And for those people, the risk is much higher. It's as high as 50% of all children. But that's way below the majority of people who have this disease. For the usual person who has onset in their 70s or 80s, the risk of heredity is a small increase over general risk. If you have one or two or three relatives who developed Alzheimer's, you're at a slightly higher risk of getting it, but not so much as would be counterbalanced by a healthy lifestyle.
Thank you very much. But there is an allele that they test for genetically?
Yes, there are genetic tests. And the interesting thing is that we have a blood test that's been developed that isn't available yet, but over the next 2 or 3 years, it may become available. And it's a very, very accurate and specific and sensitive test for if somebody's at risk to develop Alzheimer's disease and is developing it. As far as the risk from genetic factors, the most popular test is called apolipoprotein E epsilon 4. And if you have that epsilon 4 allele of the apolipoprotein E gene, you are at an increased risk for developing Alzheimer's. But again, the risk is only about twice that of the general population. And there are many people with the gene who don't develop Alzheimer's. So we don't generally recommend people getting that test because it just scares you without really giving you the information that you need. If somebody is under 60 and they have 3 relatives who've developed Alzheimer's under age 60, they should be tested for one of the mutation genes that's responsible for that autosomal dominant condition.
Thank you very much.
Sure.
Thank you, Councilwoman Gray. Now for Councilwoman Oliver.
Thank you, Madam Chair. I'm just going to ask 2 questions because we have the email, so I need to ask to refer to remaining questions. But one of them would be how does an individual get a memory check from the Swank Foundation? I mean, can someone, does it have to be a referral from a doctor, or if someone's 60 and over, those don't need to come in for a memory check? And my second one is how close do you work with the doctors? I mean, because this is close to me because I took care of 3 individuals with Alzheimer's. How close are the doctors? How close do the doctors work with your organization? And I guess how close do you work with doctors? Or is this only when you're doing a study and then you ask a doctor after someone already has Alzheimer's?
Yes, thank you for asking. Those are good questions. Let me first clarify that the Swank Foundation is a charitable organization that is not part of Christiana Care. And we are the Swank Center, named after Mr. Swank and his wife and child, who donated money to help us get the Swank Center started. The Swank Center for Memory Care and Geriatric Assessment or Geriatric Consultation is part of Christiana Care at Wilmington Hospital. We are primarily a clinical organization, although we do a little bit of research. And we especially are interested in working with doctors. So we see ourselves as a consultative service that does an evaluation and then confers with and helps the primary care clinician take care of the patient. People come to us on referral, either from themselves if they have a concern, or from their primary care clinician. We take referrals either way. Now, I want to clarify the difference between the Swank Center and the Memory Care Ambassadors, because the Swank Center is our clinical service at the hospital, but the Memory Care Ambassadors, which is part of the Swank Center, is our community outreach and educational and screening program, which does not work with the doctors except to send, with the screened person's consent, a notification to them telling them that their patient has been screened. That's what the Memory Ambassadors does, the education and the screening, but that's a public service. That's different from a medical clinic.
Madam Chair, may I follow up?
Yeah.
Yes. Mhm.
Just for clarity, so y'all just do the research as a CDC organization and gather together, and the other program is separate?
So there's no research really involved with the Memory Care Ambassadors that really is the most important part of what we do. What we do is community education and free and confidential screening for the public to help people know if they should go to their primary care clinician to get further assessment. The clinic, which is at the Wilmington Hospital, does a little bit of research. And what that means is we have some clinical trials where we might be testing a new medicine or a new test, but primarily we're a clinical organization aimed at serving the community and serving our patients. And the research is separate, voluntary, and only for people who are appropriate and informed and wish to be involved in research.
Thanks for that, Dr. James. That will be all. Thanks again.
Yeah, just to be super clear about this, nobody comes to us and ends up a guinea pig. People come to us for consultation and treatment, and we do our best to help them work with their primary care to get what they need.
Thanks for the clarity. Thanks for that.
Yeah, I know that's a concern in the community.
Yeah, thank you for that, Councilwoman Oliver. Next up, I have Councilwoman Harley.
Yes, thank you, Madam Chair. Thank you, Dr. And Jennifer. Very good presentation and good information. This is my first time I'm hearing about this as well. My question to you is this. I have 4 high rises in the 4th district that I represent. And my question to you, is there any possibility of an organization, yours or another organization, coming to those locations to do these tests? Or what would you recommend? Because again, like I said, it's 4 high rises in my district, and I think this would be an added value.
Yeah, we have done something like that in the past, and we'd be open to doing it in the future. During the pandemic, we're doing it virtually if that's an option. But when restrictions lift, we can certainly talk about coming there in person. Right, Jennifer, would you agree? Yeah.
Yes, and I would be the contact for that. So if you're interested in doing it virtually, and people have the electronic devices to be able to access Zoom, we'd be happy to do it electronically now. And then when we're able to come back out into the community, we'll come back so that we could do it for the people who can't access it electronically at this time. So we're happy to come back multiple times. And it really sounds like you have access to many people who could benefit from our service. So I would really look forward to working with you.
Yes, absolutely. Okay, Jennifer, I'll reach out to you. I'll follow up with you offline.
Wonderful. Thank you so much.
You're welcome. Thank you, Dr. Ellison, and thank you, Jennifer.
Thanks for having us.
Yes.
Thank you, Councilwoman Harley. And then next up, we have Council President Congo.
Thank you, Madam Chair. This could be a very sensitive topic. What would you suggest, even introducing the conversation around someone going to get like tested for memory loss? If you see signs in a friend or a family member, how would you suggest bringing it up in a conversation?
Dr. Ellison, can I take the first portion as part of the Memory Ambassadors program? Is that okay with you? I'm guessing he's on mute, so I will. Just in terms of the Memory Ambassadors program, we actually changed kind of our motto and we still have the same mission, but it was initially education on Alzheimer's disease and dementia and the screenings. And we've changed it over time that now it's about how do you live a brain healthy lifestyle. So that could be for me, that could be for mom. So you may encourage it, as what it is. It's teaching us how to live a brain healthy lifestyle. You can join them and go for that. And I would just really frame it in terms of, okay, what can you do to be proactive? And even if you think they're showing early signs and symptoms, they still can benefit from those changes in lifestyle, but they can come and then have the assessment. And then you could talk about that. And they've already heard the information. They know what it's about. They know that it's confidential. And we hope that by framing it as a brain healthy lifestyle, people aren't afraid to participate because we've changed is how are you going to keep yourself healthy and do this well? And you can do this.
Okay. All right. Thank you. Appreciate that.
Dr. Ellison, anything you wanted to add?
And it looks like we may have lost him because I don't see him on the Zoom anymore.
Okay.
I was trying to see. Yeah, I was looking through and I saw, I think he is off right now.
Okay. One other thing I've heard him say in the past too is there are some people who trust, some individuals who trust their primary care provider so much and will do anything they recommend for them. So it might be a conversation with the primary care provider to do that initial assessment or to say, hey, why don't you go for some education on memory wellness? So kind of working with the care provider as well. But I wish you were back because he could provide more than I can.
Well, those are good tips. Thank you.
Okay.
And Jennifer, just to add to what you had discussed earlier, I know you said there are 2 memory disorder clinics. Where are those 2 located?
We are one here, the Swank Memory Ambassadors, or the Swank Center right here at Wilmington Hospital. And then there is one offered by, I believe it's Jewish Family Services, which is also located in Wilmington.
Okay, perfect. And then I did have a question regarding the primary physician connection, but I think Dr. Ellison had addressed some of that primarily because the ambassadors are more so a recommendation to the physician versus, sometimes it gets complicated when you're sharing information of confidentiality across and brought a HIPAA and all those things. So I was wondering initially how that all worked, but I think because now you're not giving a diagnosis and you're just more so making a recommendation, that makes a difference.
Yes, and we will only send the information if the participant says, yes, that's okay with me. We do try to encourage it as much as possible and really state, as what I said in the beginning, is your doctor has so much on their plate when they come in to evaluate you. We're really here, we're the specialists, we're here to focus on this. Let us help you and your doctor so they feel that we're supporting their physician in their well-being. And that's why we'll send it, but only with their permission, of course. And then our contact information is there that if the physician has questions, they can call as well.
Perfect. And then I did also like the fact that you're now tracking the treatment option piece, that they actually following up on that, because I think sometimes there's a disconnect between the utilization of services and access. Right. So a lot of times you may see that they access it, but they don't actually utilize it. So I think that's an important piece to add into for the data stats that you guys are collecting as well.
Yes. Thank you.
Any other questions from council members? All right. Seeing none, is there any questions from the public regarding the presentation?
If we have questions for Dr. Ellison that are clinical, I can call him right now and let him know we lost him.
I think we may be good, Jennifer. I don't see any other hands raised.
Okay.
So I think you may be safe.
Okay, I just don't want to discourage anyone from asking a question because he's not here.
Yeah.
You'll
we
have
can
my
get it
email
too.
as well, and
Yep.
feel free to use that, and I can always pass questions along to him if something should come to your mind after that's clinical in nature or something regarding setting up a program. Then I would be the one to reach out to, but I'm happy to be the facilitator for whatever question you may have.
Perfect. And I will have people do that. So if there are additional questions that council members have, as well as even the public regarding, you can reach out to our office and we can send you the contact information for Jennifer and Dr. Ellison regarding any question that you may still have that are outstanding after today's meeting.
Wonderful.
So again, thank you again. And actually, Jennifer's email was just put into the chat. So if you need her email, it is there. So thank you, WITN. And also thank you again, Jennifer and Dr. Ellison. I know he's not still with us, but I wanted to thank you both again for the presentation today, and that I'm sure that our council members will definitely be in contact to talk more about how they can get it to their constituents for a service.
Wonderful. Well, thank you. And thank you for having us. We really appreciate your time on the agenda today and really allowing us to highlight the service that we can offer. So thank you. Everyone, take care.
Thank you so much.
Okay, bye-bye.
Bye. All right, and our next agenda item for this evening is a resolution that is identifying a process and focus for federal funds to be received by the City of Wilmington upon the expected passage of the fiscal year 2021 Reconciliation Act, and to ensure responsible fiscal oversight and to ensure that discretionary funding decisions are prioritized for the needs of our underserved communities that are impacted by COVID. Councilwoman Gray, will you be speaking to your legislation this evening?
Yes, I will. First, I would say the resolution has a very long title, so I'm going to try to break it down into parts. Really, I'm asking council to step up as a co-equal part of this government. We are legislators, they are executive, and to sit down at the table and try to determine what's best works for our underserved population. That's the crux of this resolution. So I'm going to break it down into the goal. The goal is, and it's in the resolution, cities continue to respond to the pandemic. We focus on effective governance, public health, and economic recovery over divisive politics. Very important. We are committed to working in a fashion to secure direct, flexible funding for vulnerable populations, realizing they were the most impacted, and to share the goal of keeping our residents healthy and our communities safe and vibrant. That's what I feel the goal of this resolution is. And then there are some examples of things. Let me say that this is a result of, as you said in the title, the Reconciliation Act that our President Biden signed, and Wilmington is scheduled to get approximately $55 million to address different COVID and economic problems. There are a lot of nuances that we haven't even realized yet because they haven't determined them. So there will be outline on how this money is used, but I'm just asking that we're at the table when it is being determined how it's going to be used for the Wilmington underserved population. So whereas a thoughtful strategy will ensure that Wilmington has adequate funds to provide continued testing, vaccination, and other health-related programs needed to fight the ongoing pandemic, to restore costs incurred due to COVID-19, and to replace lost revenue resulting from city efforts and programs to provide needed tax relief to burden citizens and loss of hotel tax revenue and other lost revenue streams. And the next thing is why we're doing this. I feel that council members are deeply involved in their communities and provide a strong voice to identify the specific needs of low-income communities and should be a strong voice in the development of programs to strengthen these communities. And next is how I think it will work. It is further resolved that council will work with administration on the development and implementation of a comprehensive strategy for the most effective use of these funds and will carefully consider the needs of underserved communities that may be given significant relief through a bold strategy associated with this unique funding opportunity. And also, be it further resolved that the council also expressly intends that discretionary decision-making of funding allocations from the coronavirus state and local fiscal recovery funds beyond reimbursement of lost city revenue and direct costs of the fight against COVID-19 be considered through a lens of advancing equity and social justice throughout Wilmington. So basically, I'm just saying, let's step up and be part of the discussion and the decisions on how this money is spent once we get the money, and also once it's determined what it can be spent on. Any questions?
Perfect. Thank you, Councilwoman Gray. Yes, we do have a question from Councilwoman Harley.
Yes, thank you, Madam Chair and Councilmember Gray for putting this legislation together. So my question would be, I have several questions. So one, when you think about $55 million and you think about the needs around the city, that's a good amount of money. But then when you start thinking about it can be spent with youth prevention, it could be spent in housing, it could be spent in healthcare issues, et cetera, et cetera. So my suggestion, I'm just making a suggestion because this is the first opportunity that we've had, even in the small group, to talk about this, is that maybe we should consider submitting 3 priorities from our areas to our council president and our chief of staff, and maybe have them to put some information together, our top 3 priorities. And again, this is just a suggestion as it relates to how we would like to see these dollars spent. We know that as it relates to testing sites, as it relates to vaccination, the state is the gatekeepers for that. The public health department is going to continue to, administer testing and administer the shot. So we kind of know that they're going to make sure that's taken care of. So I was just thinking recently, just on my own, would some of the areas and how would I like to see that money spent as it relates to the 4th district and those underserved communities. So I have started thinking about it. And again, my suggestion is just a suggestion, like I said, was to send maybe my 3 top priorities out. And then once they're all collected, then maybe they could be shared. That's all I have right now. Thank you.
Thank you, Councilwoman Harley. Did you want to respond to that, Councilwoman Gray?
Yes, I will. I think all ideas are good. And if Councilwoman Harley doesn't want to actually sit at the table, that's fine. But I'm advocating that we are at the table when we discuss what issues are the priority for the different districts in the city as a whole. But all suggestions are welcome. I'm not advocating any particular approach or community groups, but that's another thing. I think, in my opinion, I think we need to be at the table so that we can find some new resources, or as the mayor said in his address, find some programs that are going to be sustained and give long-term growth to the city of Wilmington.
Can I have may I have a follow-up, Madam Chair?
Yes, Councilwoman Harley.
Yeah, okay, so thank you. Councilmember Gray, you're absolutely right. So your response was being at the table, which I definitely agree. I don't know if 13 people can end up at the table, or if we should try to find out, who wants to be at the table. But again, I was just thinking, before we actually get to the table, to get our thoughts organized as it relates to the city council members, get our thoughts organized in terms of, as a collective. I mean, 2 or 3 or 4 of us may have some similar suggestions and ideals. There may be several of us that may be thinking about housing, maybe thinking about youth prevention. So that's what I was thinking in terms of how to address it, decide on a collective top priorities from the council, and then those that would like to be around the table, then of course, do that as well. So I just wanted to clarify my statement. Thank you.
And to your point, and to both of your points, Councilman Gray and Councilman Harley, I think both of those things can be done. So based on, for example, the resolution passing for council on April 1st, and then having more of an internal discussion now that this has passed, as far as the resolution that we all agree that we want to do this, that we can now say, as you said, Councilman Harley, okay, what's your top 3 things that you may want to see within your district that may be changed that's affected by COVID? And then we could present those items to the administration after that. So that just throwing that as an option to put both of those things together.
Correct.
Yeah. Council President Congo.
Yes, thank you, Madam Chair. Thank you, Councilwoman Gray. This is a great idea. I think that we have to take advantage of this situation. We all know it's a once in a lifetime opportunity. I don't think that we can leave the public out of that conversation. I think this would be an excellent opportunity to have a committee of the whole meeting and invite the administration. I'm not sure that's ever even been done, but I think this is the perfect time to do that, so we can have those conversations with the public involved. And at the end of the day, it's their money. I know that we can do our own kind of research and get the opinions of the public, but I just think it would be a great opportunity to have everyone at the table, not just us as council persons or the administration, but the public also. Just an idea. Thank you.
Thank you, President Congo. Councilwoman Gray, did you want to respond to the comment made by President Congo?
I think they're great comments, but I have some more information that I think would be sort of informative as to why I think that we need to do this, so that we can focus. I'm sorry, I'm not on. So that we can focus on the underprivileged and underserved community. Last year, the city got $12.7 million from the county. Well, the county just got it to disperse to different municipalities. And Wilmington got $12.7 million. Of that $12.7 million, $1 million went to special projects like PPE, supplies, sanitation, technology, and other things that the city thought were necessary or because of COVID. That's 8% of the $12.7 million. They gave relief for help with utilities, water and sewer utilities only. And that was $500,000, which is 4% of the money. That was the only direct money given to the community. And the last is 11.1 million. 88% of the funds was spent on personnel, with 10 million of that paying the public safety salaries. So, and all of this was, as far as I know, all of this was within the purview of how they could spend the COVID money. But even with the $500,000 that the executive branch set aside for the water and sewer bills, that money goes right back to the city. I mean, what about gas and electric? These are the kind of things that I think going forward we can possibly identify. But 88% of the money, like I said, went on personnel, with 10 million going to public safety. So that's how the CARES money was spent last year, within the confines of the rules. There's nothing wrong with that. But I think that this time we need to focus on the underserved population. And also this time, the time limit for spending the money, I think, is December 2024. So there's no rush to throw the money to different programs that aren't long sustaining.
Thank you, Councilman Gray. Yeah. Are there any additional questions from, or I would say suggestion for Councilwoman Gray? Councilman Harley?
Oh, yes. Thank you, Madam Chair. So again, I commend Councilmember Gray, for the resolution, but again, I would hope that we all were thinking already about how we would like to see that 55 million spent, because again, we know that a resolution is it's not binding. I mean, it's a good suggestion and ideal. And again, I'm not taking anything away from it. I think it was absolutely, a great ideal. But again, something like this, I would think that we were already proactively thinking about, how we could utilize this money, get the biggest bang for a buck. And that's what I'm thinking about, the biggest bang for the buck. There are some organizations that had already start reaching out to me regarding the youth. We know about the violence and how that's been plaguing our city. So I got some information, from some of the youth organizations. So that was one of the reasons why I am also happy to be on this call, because at least we can talk about some suggestions and talk about how we can start organizing. And as it relates to the community, one of the things that I do, and I know we all work differently and we all do things differently, but I'm constantly engaged with my constituents through civic associations, asking questions, letting them know, having that dialogue. Because one of the things that I have learned about the community, they don't have most of the information that we have to make some of the better decisions. When you think about on a scale of 1 to 10, most of the time they're 1 on the scale of having information. So we have more information than a lot of times, the people in the community. So let's make sure, as we are working with the community, and like I said, we all work differently, but I'm constantly getting information from my constituents, and I'm constantly sharing information with them, because sometimes they don't have the knowledge of knowing what is really critical versus the things that may interest just them. But when you think about the money should be spread out throughout our districts, throughout, our areas. So I'm just saying, let's remember that and be mindful that I see so much on social media, and most of the information is not accurate. And we gotta help educating the community if we're expecting to have a healthy, purposeful, value adding conversation about how we're doing things, because they elected us to be their voice. So we gotta continually have conversations. Those conversations never stop with me in terms of what their interests are, what their issues are, and what their concerns are. So I don't always have to have a special meeting to find out from them what you want to do. It's an ongoing conversation. Thank you.
Thank you, Councilwoman Harley. Councilwoman Gray.
Yes, I think that's a good idea. And, and if you can bring those ideas to the decision and the discussion about how the money is going to be spent, that's all I'm saying that we should be able to do, whether you give your ideas to your representative that goes there. But I think we need to be able to sit down at the table. Last time with the CARES money, they brought the distribution to us to vote on, but they had selected the community groups that were going to get the money. So that's the reason I'm just saying that. And also, I agree, we're the elected officials and we should bring it to the table. But I do think we need to ask them, like I think almost all the community might say they need help with their gas and electric. And other things that from reading I've come across that we might not be aware of, and the community tell us, is how many bus stops have been overlooked, or how many lines, what do they call them, since I don't take the bus, how many routes have been stopped because of COVID illnesses or because they've lost staff. So these are things that we may not realize, but the COVID money may be able to, well, so far, the last money could be used to reinstate those bus lines, bus routes, or bus schedules. So I wouldn't know about that because I don't take the bus. I mean, I read that there have been, bus routes that were stopped. So I don't think anything is a bad idea. All of them can be incorporated. I just think that we should be at the table to discuss. Oh, one other thing. I hope I'm not speaking out of turn, but I know that the county exec and the mayor have met to discuss maybe cooperative ideas across county city lines that help. This was about stopping the violence. So there could be a larger picture of a discussion that we can be involved in that this money may be used for. That's all. Thank you.
Yeah, and I think again, if I'm correct me if I'm wrong, Councilwoman Gray, the main focus for your resolution is just to bring us to the table to have these discussions,
Correct.
so that we can have more discussion like what we're having tonight, but also have it with the administration and the public. So
Right.
I think that's the first step. And then a lot of the ideas that we're brainstorming on tonight are additions to once we are able to make sure council as a whole is in agreement into being at the table and having discussions around this $55 million that's coming around. So, Councilwoman Harley.
Thank you.
Yep. Councilwoman Harley.
Oh, yes. I meant to say earlier that we know there are guidelines. And so one of the first steps I think we want to do is make sure that we are making suggestions within the guidelines of how the money's being spent. That's number one. Secondly, it would be a great idea if we could get staff to reach out to Delmarva, because I know Delmarva has also launched an initiative around COVID in terms of how customers can get different, they have different programs. So I think we need to understand what kind of programs that are already being offered by Delmarva as it relates to constituents. And I know we were talking about bus stops and stuff like that. Let's keep in mind that's under the state. The state, you know, we know the state they're the gatekeepers, and they also have the money when it comes to transportation, education, medication, and incarceration. So some of the bus stops in terms of suggestions or ideas, we may need to address that in a way where, one, they will be paying for it with the state funding that is used for DelDOT for transportation to cover whatever is needed. So I just wanted to share that, because when we start talking about this money, I think it's good to know what are the parameters, because I know we don't want to start brainstorming like way out here and way over there to find out, oh, the requirements are this, this, and this. And so I just think that would be good, one, for us to definitely find out, even if they're soft parameters, what are they looking like? What are they talking about in terms of how the money can be spent? And when we identify what it looks like, and from the different council members, we may need to look at where resources are already being earmarked for some of these types of things that we may be thinking about. Thanks.
Yep, Councilman Harley, I think those are conversations once we get to the table and can start to dive into what are the parameters of what you can and can't. And then that way that can be deciphered between making sure we're not operating outside that, who's responsible for what during that process. Again, I think it's primarily for Councilman Gray is that we just get to the table where we can have these larger discussions on the topics that you have been discussing.
Yes, great idea. Thank you.
Councilwoman Gray?
In the resolution, there are general parameters for this money. And Chief of Staff Daniel told me that they should have within the next day or two, they hope, more guidelines. But we do in the resolution, there's 1, 2, 3, 4, I won't bore you with reading them, of the general guidelines of how the money can be used. Also, a lot of the things you mentioned about the bus stop, I have to defer to Councilwoman Dixon, but I think our CBG money pays for those type of things, and we get that money every year.
Not for transportation. Councilwoman Gray?
Okay, not for the,
Mm-mm.
but for the employees, it may pay for it that were laid off because of COVID. That's the type of thing. But anyway, like you said, I just want us to be at the table, to have the discussion, to have input. Like Councilwoman Harley said, we know our districts, or a lot of us know our districts, so we can bring that input to the table. That's all.
Yep. And thank you for that, Councilwoman Gray. And is there any additional questions from council members? All right. Any questions from the public regarding this piece of legislation? All right, seeing none. This is a resolution and does not have to be voted out of committee, but this will be on the agenda for April 1st for a larger council meeting for it to be voted on as a whole. Thank you, Councilwoman Gray, for the legislation this evening.
Yes.
And our last agenda item for this evening is to discuss a resolution encouraging the state of Delaware to take action and to develop and support legislation that will further prevent the sale of tobacco flavored products. This was in support of what Representative Melissa Minor Brown in her efforts to end the sale of flavored tobacco products in the state of Delaware. This would protect Delaware communities and specifically communities of color that are harmed by having flavored tobacco, as well as increasing tobacco experimentation that is happening by our youth, and also pulling that generation into a cycle of addiction based on being in impoverished communities of color. I just wanted to make note that there are 31 organizations, along with parents and schools, that have signed on to strongly support the legislation to end the sale of flavored tobacco products. And leading in this effort is the Cancer Action Network, the American Heart Association, the American Lung Association, and the Tobacco Free Kids Action Fund. This again is as children are being affected by, and I didn't realize by the statistics that are put out there regarding how students are being targeted. There are currently 13.6% of Delaware high school students that are actively using e-cigarettes. There are also statistics around 7.3% of Delaware high school students are smoking cigars. And we also have that Delaware has been recently received an F in regards to the American Lung Association on its efforts to restrict flavored tobacco products access. And even though the tobacco sale is 21 in Delaware is a long-term solution, we still have to figure out how to reduce it among usage from our youth. And a lot of times they are, for example, the methanol cigarettes are highly used among African Americans and youth, where that our population, African Americans, are 85% in comparison to 29% of white smokers. Half of the youth smokers use methanol cigarettes as well, and that they're targeting because they are flavored tobacco. That is what a lot of the students are attracted to, is because they're saying, oh, it tastes good because, it's flavored, is the reason why they're using it. And students have said 7 out of 10 of the current youth who are using e-cigarettes basically said it was because they like the flavor of it. So we want to make sure that our our young people, and I just learned this too. I didn't even realize it was flavored hookahs that are also attracted for kids too. In addition to Delaware vape shops that are still marketing for flavors to youth and new smokers. So there are a lot of added dosages of why it's important for us to sign on to with the General Assembly and support making sure that our young people, but also our Delawareans are protected, especially within our communities of color. So this is what this resolution is particularly focused on. And I just wanted to bring it to the attention of our council. Any questions regarding the legislation from council members? Councilwoman Gray?
I'm just curious, sorry, I haven't read it. Are there specific suggestions like raising the price of the flavored ones, or are there suggestions in the legislation, or are there any? That's basically what I'm asking.
So there are none in the particular piece of legislation. It's just more so talking about how the effect of flavored tobacco is being used by youth. And also just making sure that we help the state around advertising, that it's not being targeted toward youth, and in how it is disproportionate to communities of color. So that's primarily what the resolution is focused on.
Thank you.
Yeah. Any other questions from council members? All right. Any questions from the public? And I think I see one hand already. Nora?
I'll be short. I'm a cancer nurse. I've been on the Delaware Cancer Consortium for over 20 years and a part of the leadership council for the American Cancer Society. This resolution is important for you to consider. Please get on board with it. 80% of cancers are tobacco driven, and our youth start this addiction process in the very beginning, and we need to not let that happen. So that's my words. I would appreciate that the council supports it.
Thank you, Nora, for your comment. And then I see Councilwoman McCoy.
Thank you, Madam Chair. I'm sorry. I don't know. I'm in my car and something went crazy. If you called on me before, it kind of froze. I am definitely in support of this piece of legislation. Initially, like last term, I had put something together basically just to deter the promotion of tobacco products to our youth. To me, this legislation is basically like a natural progression to that, because I don't think that we are as I think we're definitely unintentionally promoting the smoking of tobacco and different products to our youth. And I think that that's something that we need to definitely pay more attention to. The flavors is definitely in the types of flavors that are actually being promoted are like, are fruit flavored, candy flavored, and things of that nature. And that's only really to make certain that they're hooking younger and younger smokers. So I think that this is actually, this is something I support. I'm glad that this resolution has come about, and I do hope that we will start really taking it seriously. I'm sorry, I wanted to make you aware that the cigarette is called menthol. It's menthol cigarettes, and I used to be a smoker. I've stopped smoking 21 years ago, and I do understand how hard it is to pick up a habit and to be able to lay it down. So this is something we definitely want to make certain that our children do not pick up. So thank you so much for making certain that you put this resolution together.
Thank you for correcting my language. As you can tell, I'm not a smoker. So thank you, Councilwoman McCoy, for the correction. And thank you for again being a co-sponsor on it. I know this is an extension of the work that you already have been currently doing and working on. So I know this was when we put in the legislation, we have put it around the same time. So was perfect timing and perfect alignment regarding focusing on this piece to make sure that our communities are protected, because, predatory, what we say, marketing is always at its finest when we're trying to make sure that our folks are not adding to health implications by doing this, especially at such a young age.
I do agree. Also, if I may follow up, I
Yeah.
just would like to add, as looking at the last piece of legislation that actually went through, made me more aware of promotion, and people really should take a look at the retailers in the areas, especially they live here within the city, and you can basically see, if you're at a retailer here or a store here, and then actually go out to like a more suburban area, whatever, you will definitely see the difference when it comes to how the cigarette smoking is actually promoted. Like, I don't think if you go out into, leaving out of the area here and going up 52 or whatever, I don't think you can find a sign that actually could say Newport or a pack of cigarettes anywhere or any type of retailer, but yet you will see that predominantly all through our corner stores.
Absolutely, Councilman McCoy. Again, that's targeted marketing.
Yeah.
Any other questions or comments from council members or the public? All right, seeing none. This is also a resolution that does not have to be voted out of council, out of this committee. And it will be on the agenda for April 1st as well, to be voted on by full council. And that is our last agenda item for this evening. And I want to thank you all for staying with us through all of our presentations and our 2 resolutions this evening. And we look forward to having you at our next meeting. And if I will entertain a motion to adjourn.
So moved. We need a second.
Can somebody second?
Second.
Thank you.
Thank you.
Thank you,
Bye.
Councilman Fields. Have a good evening, everyone. Thank you for joining us.